Have you ever pondered over the intricacies of the blood coursing through your veins? This crimson fluid, a life force within us all, is far more complex and intriguing than you might imagine. At the heart of this mystery lie the blood cells, the unsung heroes of our body's health and well-being. Let's embark on a journey into the human body, to the bustling highways of our circulatory system. Here, billions of blood cells zip around, each with their own crucial role to play. Among these are the red blood cells, or RBCs, and the white blood cells, or WBCs, each a protagonist in the story of our health. RBCs are like the delivery trucks of our body. They are packed with hemoglobin, a protein that binds to oxygen in our lungs and carries it to every nook and cranny of our body. Without RBCs, we would be starved of the oxygen we need to survive. But their role doesn't end there. They also carry away carbon dioxide, a waste product, from our cells back to the lungs, where it's exhaled out. On the other side, we have our body's vigilant security guards, the WBCs. Their job is to guard us against infections, bacteria, and viruses. They are the frontline warriors of our immune system, always on the lookout for harmful invaders. When an invader is spotted, these cells spring into action, fighting off the threat and keeping us healthy. Now, imagine what would happen if these cells didn't function as they should. This is where we encounter hematological diseases, disorders that affect the production and function of our blood cells. They can disrupt the delicate balance within our bodies, leading to a range of health problems. As we delve deeper, we'll discover the pathophysiology of two such hematological diseases, anemia and leukemia. These diseases, while different in their nature, both stem from issues with our blood cells. So fasten your seatbelts as we journey into the fascinating world of blood cells and diseases. Stay tuned for the next chapter of this intriguing story. Imagine a car running low on fuel, struggling to reach its destination. Now, imagine your body being that car, with anemia being the low fuel condition. Anemia is a condition characterized by a decrease in the number or quality of red blood cells, or RBCs, in your body. These cells, packed with a molecule called hemoglobin, are the primary transporters of oxygen from your lungs to the rest of your body. When you're anemic, your body simply doesn't have enough RBCs to perform this vital function effectively. The causes of anemia are varied. It could be due to your body not producing enough RBCs, or it could be because your body is losing or destroying these cells faster than it can replace them. Nutritional deficiencies, such as low levels of iron, vitamin B12, or folic acid, can also lead to anemia, as these nutrients are crucial for the production of healthy RBCs. Now let's delve into how this condition affects your body. As we've mentioned, RBCs are your body's oxygen carriers, so when their numbers dwindle, less oxygen reaches your tissues and organs. This lack of oxygen can lead to fatigue, one of the most common symptoms of anemia. Without enough oxygen, your heart has to work harder to deliver what little oxygen is available to your body, which can lead to an irregular heartbeat, an enlarged heart, or even heart failure. Anemia can also result in pale skin due to the lack of oxygenated blood flowing through your skin. Other symptoms may include shortness of breath, dizziness, and cold hands or feet. In severe cases, anemia can even cause damage to organs due to the lack of oxygen. This is why it's so important to recognize the symptoms of this condition and seek treatment. So, anemia essentially leaves your body starved for oxygen, affecting every function it performs. Like a car running low on fuel, your body struggles to function optimally, and without proper treatment, this can lead to serious health complications. So it's crucial to be aware of this condition and know how to recognize its signs. Now let's shift gears and move to a different but equally important blood cell, the white blood cell. What happens when these cells, responsible for fighting off infections, go rogue? Enter leukemia, a dark horse in the world of blood disorders. This disease is a form of cancer, but not the kind that forms tumors. Instead, it's an insidious invasion of the blood and bone marrow, characterized by an abnormal proliferation of blood cells. And the main culprits here? White blood cells or leukocytes. Imagine your body as a bustling city, with white blood cells being the police force. They keep the peace, fighting off harmful intruders like bacteria and viruses. But in leukemia, it's as if the police force has gone rogue. They start to multiply uncontrollably, crowding out the healthy cells. They become so numerous that they start spilling out of the bone marrow into the bloodstream, and from there, they can travel to other parts of the body. Now, leukemia isn't just one disease. It's a group of diseases, divided into 4 main types: acute lymphoblastic, acute myeloid, chronic lymphocytic, and chronic myeloid leukemia. Acute forms are fast-growing and need immediate attention, while chronic forms progress more slowly. Lymphoblastic leukemia affects lymphocytes, a type of white blood cell, and myeloid leukemia affects myeloid cells, which can become white blood cells, red blood cells, or platelet-making cells. Each type of leukemia behaves differently, but they all disrupt the body's delicate balance. They can lead to frequent infections, because the rogue cells aren't good at fighting off invaders. They can cause fatigue and weakness as they crowd out red blood cells that carry oxygen. They can even lead to excessive bleeding and bruising, as they leave less room for platelets, which are crucial for blood clotting. Leukemia, therefore, is a serious derailment in the body's defense system, leading to a host of complications. While both anemia and leukemia involve blood cells, they are quite different in nature and effects. Let's start with anemia, a condition characterized by a lack of healthy red blood cells, which transport oxygen around the body. This manifests in symptoms such as fatigue, weakness, and shortness of breath. The treatment for anemia often involves dietary modifications or supplements to increase iron, vitamin B12, or folic acid, which are all essential for red blood cell production. In severe cases, blood transfusions or medications to stimulate the bone marrow may be necessary. On the other hand, leukemia is a type of cancer that begins in the bone marrow, leading to the production of a high number of abnormal white blood cells. These cells do not function properly and can crowd out healthy blood cells, leading to a variety of symptoms like fatigue, fever, frequent infections, and easy bruising or bleeding. The treatment for leukemia is more intensive and often involves chemotherapy, radiation therapy, or stem cell transplant. While both anemia and leukemia may cause similar symptoms like fatigue, their pathophysiology is distinctly different. Anemia stems from a deficiency, while leukemia is due to an overproduction of abnormal cells. Furthermore, their treatment plans diverge significantly, with anemia often managed with dietary changes and supplements, and leukemia requiring more aggressive interventions, such as chemotherapy or stem cell transplants. Despite these differences, both conditions underscore the importance of our blood cells in maintaining overall health. Anemia highlights the role of red blood cells in oxygen transportation, while leukemia emphasizes the function of white blood cells in defending our bodies against infections. In conclusion, anemia and leukemia, while both hematological diseases, differ in their cause, symptoms, and treatment. Anemia, a condition of deficiency, can often be managed with dietary changes, whereas leukemia, a form of cancer, requires more intensive medical interventions. Thus, while anemia and leukemia both disrupt the harmony of our body, they do so in very different ways. The labyrinth of hematological diseases is vast and intricate. As we've journeyed through this complex world, we've unraveled the mysteries of blood cells, the nuances of anemia, and the enigma of leukemia. Let's take a moment to recap. We began our exploration with the mystery of blood cells, these tiny powerhouses that are so integral to our health. We discovered the pivotal roles of red and white blood cells, and the dire consequences when their balance is disturbed. Then, we delved into the world of anemia, a condition marked by a deficiency in the number or quality of red blood cells. We learned about the various types of anemia, each with its unique causes and symptoms. From iron deficiency anemia to sickle cell anemia, we saw the broad spectrum of this disease and its potential impacts on the body. Our journey then took us to the realm of leukemia, a group of cancers that primarily affect the white blood cells. We explored the different forms of leukemia, from acute lymphoblastic leukemia to chronic myeloid leukemia, and how they mutate the body's defense mechanism into a fatal threat. We also compared anemia and leukemia, two distinct diseases with different pathophysiologies but a common thread: the disruption of the balance of blood cells. Understanding these diseases isn't just crucial for medical students, it's vital for us all. After all, knowledge is power, and in the world of health, it can be a lifesaver. Grasping the complexities of anemia and leukemia, their causes, symptoms, and treatments, equips us with the tools to recognize, prevent, and combat these diseases. Indeed, the more we learn about these diseases, the better equipped we are to fight them. Knowledge is not just power, it's our armor in the battle against hematological diseases. So let's continue this journey of learning together. Subscribe for more because you won't find me later.